Well, it's a pleasure to be here today to speak to all of you on this great panel. I'm Emily Kaltenbach. I am the Senior Director for Criminal Legal and Policing Reform at the Drug Policy Alliance. If you haven't heard of the Drug Policy Alliance, we are a national advocacy organization advocating for to end the war on drugs and to address the harms of both problematic drug use, but also the harms of criminalization and the war on drugs on marginalized communities all across the United States. I work in New Mexico. I was born and raised here and started with Drug Policy Alliance over a decade ago, leading our New Mexico office. And I'm really excited to talk about some of the harm reduction work in New Mexico specifically and some of our work nationally. I was asked about sort of some of the harm reduction work in New Mexico at a legislative level, since we do a lot of advocacy here and have for now over 20 years. We've had an office in New Mexico. And I've seen a lot of positive movement to embrace harm reduction. New Mexico actually led in harm reduction in the country over 20 years ago. And I think we still do. I mean, one example is we were the first state to actually pass a 911 Good Samaritan law, which protected people if they called 911 on behalf of an overdose. Many people don't realize that New Mexico actually led the nation in overdose deaths for many, many years. And we still experience really high overdose deaths. And so even though other states, because of fentanyl may have displaced New Mexico, we're now 7th or so, but we still really do experience an increase in overdose deaths. Earlier on, it was really about heroin and black tar heroin. I think that changed a bit. We see more fentanyl deaths at this point, also rising methamphetamine users. And we know that a lot of people who use drugs in New Mexico are polysubstance users. And so finding creative and comprehensive harm reduction programs is essential for New Mexico if we're going to be saving lives. So we already have this great foundation. I feel like our legislators really understand harm reduction, probably more than other state legislators around the country, because we have really been leading and been on that cutting edge. But just recently I've seen a renewed interest in taking New Mexico to that next level, because we aren't seeing a reduction necessarily in overdose deaths. So what are those comprehensive reforms? And obviously overdose prevention programs is one of many, right? And so that is a program, a model that the Drug Policy Alliance in New Mexico has been looking at for many, many years. It's an issue we have been advocating for nationally for decades. It's a core priority of our organization, because we know that it's an effective harm reduction strategy and it saves lives. And we are currently in an overdose crisis and we must be saving lives. So what does that look like in New Mexico? Well, we were main architect and drafting of an overdose prevention program bill a couple of years ago. We have been educating our legislators for now almost a decade on the Vancouver model and other models around the world that have proven to work. We have the evidence to show that. So a core group of our legislators really are very educated on overdose prevention programs. We've brought people from Vancouver. They've looked at the science and the research over many years. And so we first started with a memorial, and that said, this is an important program, although it didn't codify anything in state statute. And as I mentioned a few years ago, an actual robust bill was introduced. The bill actually passed through the House of Representatives with very strong support, including some bipartisan support, which I think is really important to note. And it went over to the Senate, and it was unfortunately stalled with a whole host of other bills in Senate Judiciary, and time ran out. And in New Mexico, when the clock runs out, and you have to start over again. So that's what we plan to do in our next policy session. So New Mexico, we have a 60-day session, which is budget and policy. And then every other year, we have a 30-day session, which is just budget. So that's why the bill wasn't introduced last session. We're going to reintroduce use it. We also, unfortunately, our amazing sponsor, Representative Deborah Armstrong, retired from the legislature. So we are working on a new sponsor to champion overdose prevention programs. And so I'm feeling very positive that there is the political will in New Mexico to pass a bill like this. Now, I think it's important, though, to think about overdose prevention programs, as I mentioned earlier, as part of a more comprehensive approach. New Mexico is a very rural state, and OPP programs may not be appropriate in a more rural area, or do we have to look at more mobile options for OPPs? And so all of those things are important. So what this bill did was really authorize the local jurisdiction to open up an overdose prevention program if that was appropriate for their community. And so I think, again, it's important that it's on a community by community basis. We also know in New Mexico, a lot of people use drugs at home with other people, and traveling to an overdose prevention program may not be feasible, right? The transportation. So as we look at overdose prevention programs in New Mexico, maybe we need to start looking at more urban areas, concentrated areas like, Albuquerque and Santa Fe are two jurisdictions that an overdose prevention program may easily be feasible in. And we've started to talk to folks on the ground in a couple of jurisdictions across New Mexico who are interested in exploring what an overdose prevention program might look like in their community. I think there is still obviously stigma and lack of education around overdose, around drug use in general, and around overdose prevention programs. And so that's always we can't just introduce a bill. There has to be education that happens on the ground, organizing work, a lot of questions such as, will this enable drug use? Will we see crime rates rise? Those are all questions we often get. And then actually we have a lot of evidence to show that in fact, those things do not occur. In fact, the overdose prevention programs are a bridge, right? When people have a safe place to use, there are opportunities to engage individuals in additional services, wraparound services, and meet people where they're at. Not all people are going to want to go into a detox center or a full treatment program, but maybe there are issues such as food and housing and other really basic needs that can be addressed in an overdose prevention program. And it also really does address public safety and public order in a community that might be experiencing open drug use on the streets where there is concern. So in fact, and I just want to point to New York because we need to really commend New York for stepping up and really having the first sanctioned overdose prevention site in the United States. Drug Policy Alliance has been advocating and working with allies on the ground for many, many years to get this started. And if you look at the first 5 months of the programs in New York, both in Washington Heights and in East Harlem, we see that just in the first 5 months, almost 300 overdose deaths or overdoses were reversed and lives were saved. We also saw like a 98% reduction in syringe litter. The city sanitation workers apparently called the program and said, what's going on? We're not picking up as much litter. And so when we think about the impact that overdose prevention programs can have on the broader community, it's not just about, it's most importantly about saving lives, but it's also has a broader reach to communities to make it truly is a public health approach, right? And a public safety approach. So there's still the political will in New Mexico. We're going to be reintroducing what was House Bill 123. We see both. I still see the political will there. We see public support. We've done polling that shows that likely voters in New Mexico support overdose prevention programs. That tracks with what we're seeing nationally, that Americans support overdose prevention centers. A recent poll, I think, showed about 64% of likely voters expressed support for overdose prevention programs. This is a really important program that we're going to be advocating for in California. We know that there was legislation passed in Rhode Island, so we keep your eyes open to see what occurs there. The New York programs, there has been movement in Colorado and obviously in New Mexico. And again, I think it's really important that we educate people about what harm reduction is, because when people hear about harm reduction, they get it, right? And then their support really does increase. And I think your research is really important, that you talk about overdose prevention programs, because that's what it is, right? It's about saving lives. It's about compassion. It's about public safety. It's about public health. It's not, when I think we've more recently started using supervised consumption spaces or overdose prevention programs, because in the past it was, I think, safe injection facilities. And unfortunately, there's still a lot of negative reaction when people think about needles and injection. And these programs are not just about injection. These are programs that support people who consume drugs in many different ways. And so we need to, we're going to continue to help lead this issue in the United States and New Mexico. And we're really excited to work with allies who are very committed to making this happen. So thank you.